Hello guys, welcome back to my channel and thanks for stopping by. If you're new to the channel, please subscribe and like my videos. In today's video, I'm going to talk about informed consent and ethical principles in nursing. These topics will be very helpful to you if you have a scheduled NCLEX-RN examination next week or next month, as these topics may come out on your test. So break a leg, guys. Now let's jump right into our topic. What is informed consent? It is a principle in medical ethics and law that a patient must have sufficient information and understanding before making decisions about their medical care. Pertinent information may include risks and benefits of the treatments, alternative treatments, the patient's role in the treatment, and their right to refuse the treatment. The patient must be competent to make a voluntary decision about whether to undergo the procedure or intervention. Before signing an informed consent form, the patient should know whether other treatment options are available and should understand what will occur during the pre-operative, intraoperative, and post-operative phases of the surgery, the risks involved, and the possible complications. The patient should also have a general idea of the time required from surgery to recovery. In addition, he or she should have an opportunity to ask questions. It is not the registered nurse's responsibility to explain this information to the patient. It is the responsibility of the healthcare provider to have the nature of the procedure explained to the patient, its risks, benefits, complications, alternatives, and the role of the patient in the treatment. The key points to take away from informed consent are: so if you are the registered nurse assigned to a patient who needs to sign an informed consent, your only responsibilities will include the following. Number one, you are there to have the consent signed by the patient or by the person delegated as the healthcare power of attorney. Remember, guys, that this person being delegated as the healthcare power of attorney can be revoked by the patient at any time. Secondly, you only act as a witness that the patient or the client signs the informed consent on their own free will and not being forced by someone. Thirdly, as a nurse, you can ask the patient before signing the consent if he or she has clarifications or questions about the procedure. If the patient said yes, then you can call immediately the attention of the healthcare provider who's going to do the procedure and have them explain again to the patient the nature of the procedure, its benefits, risks, alternatives of the procedure or treatment, complications, and the role of the patient in the treatment. If the patient, after the explanation of the healthcare provider, is satisfied, then he or she can go ahead and sign the informed consent. If the patient refuses to sign the informed consent because he or she refuses the treatment, then the medical provider or the healthcare provider should respect the patient, because every patient has the right to refuse a treatment. That's included in the 10 rights of the patient. Also, another key point to remember is that if the patient is unable to sign the consent because of a disability or an illness preventing them from signing the informed consent, and that will also apply to the person delegated as the healthcare power of attorney, then their thumb marks with an ink or putting an X mark on the signature panel will suffice as their signatures, and that is allowed as their signature on the informed consent. So those are the important key points in informed consent as a registered nurse. Let's discuss our next topic, which is the ethical principles in nursing. They are autonomy, advocacy, beneficence, non maleficence, justice, fidelity, and veracity. Let us discuss them one by one, starting with autonomy. In nursing, the ethical principle autonomy is a patient's right to make their own healthcare decisions. For example, a patient has a right to refuse treatment. Remember the 10 rights of the patient, and one of them, the right to refuse treatment. Second principle is the principle of advocacy. In nursing, the ethical principle of advocacy is to promote and protect the patient's rights, health, and safety. In other words, nurses must advocate for their patient's best interest. For example, a nurse practicing advocacy would notify the provider about a concerning change in a patient's condition. Another example is a nurse would reach out to a social worker if the patient has a problem in the community. The next principle is the principle of beneficence. In nursing, the ethical principle of beneficence simply means to promote good. For example, if a patient has been in the hospital for weeks, a nurse showing beneficence might take that patient outside for some fresh air. Next principle is non maleficence. In nursing, the ethical principle of non maleficence is to avoid causing harm. For example, a nurse demonstrating non maleficence would perform multiple checks before administering medication to avoid a dangerous medication error, and that would prevent medication errors. The difference between beneficence and non maleficence may seem subtle, but you can remember that beneficence is promoting good and non maleficence is avoiding harm by remembering that prefix mal means bad, meaning malnourished, malfunctioning, malpractice, malodorous. Just remember the witch in Sleeping Beauty, her name is Maleficent. So, maleficence is something bad. Next, principle is the principle of justice. In nursing, the ethical principle of justice means to treat patients fairly. For example, if you were juggling multiple patients, you would not provide better care based on who has the best insurance or who among the patients are the richest or the poorest. You need to treat them fairly, fair and square. Nurses practicing justice do not provide care to patients differently based on their race, gender, identity, sexual orientation, or religion. Nurses practicing in a just manner provide care equally amongst their patients. The next principle is the principle of fidelity. In nursing, the ethical principle of fidelity means to be faithful or loyal, which means that you keep promises to your patients. For example, a nurse told their patient they were coming back in 30 minutes to check on their pain, would either come back or delegate somebody else to come back if they got tied up. So, for example, if you said to the patient that you will come back in 13 minutes, then you need to come back in 13 minutes because the patient is expecting you. Or if you said to the patient that you are giving them a bed bath, then you need to come back and give them a bed bath because fidelity is like loyalty. You promise to the patient and you must keep your promise. So that is fidelity. The next and the last but not the least is the principle of veracity. Veracity means to tell the truth, to never lie to patients or give them knowingly false reassurance, which is also lying. For example, if a patient was starting chemotherapy and asked about the side effects, a nurse practicing veracity would be honest about the side effects they could expect with chemotherapy. Also, veracity is truth and is an essential component of a therapeutic relationship between a healthcare provider, a nurse, and their patients. So, those are the principles, your ethical principles in nursing. Thank you. To summarize, your ethical principles in nursing includes autonomy, advocacy, beneficence, non-maleficence, justice, fidelity, and veracity. So this wraps up our video for today. Thank you so much for joining me. If you haven't subscribed yet, please click on that subscribe button and like my videos. Break a leg on your test. I know you can do it. Sometimes we feel that it's like finding a needle in a haystack. However, you can do it. Just believe in yourself. Thank you and see you soon. Have a great day.